Welcome to our Open Mic webinar for this week. This week, our chairman of the Medical and Scientific Advisory Committee, Dr. Van Nguyen, will present on the latest trend and innovation in the diabetes space. Here, I'm going to share with you guys an overview or summary of what Dr. Van discussed. First, Dr. Van went over the underlying science and medicine of diabetes, that is the pathophysiology of diabetes. He first discussed about the signs and symptoms of diabetes, and then he discussed about the different types of diabetes type 1, type 2. Moreover, Dr. Van also discussed about the dreaded complication of diabetes, which is the most cumbersome aspect of diabetes itself.
As you see on the slide there, we're going to discuss the innovation and trends in diabetes mellitus today. As you know, a lot of us have been affected by diabetes mellitus, but that incidence is going to increase significantly over the next 30 years, 40 years, 50 years. As you can see, the classification of diabetes is being classified based on a blood sugar that obtained by fasting level. So normal should be between 75 to 99. Some people say 100. Some people say hypoglycemia unspecified is any time when you have high sugar of 100 to 125, and then above 125, which is 126 or more, being considered for diabetes mellitus. Of course, further testing and evaluation need to be done before the definitive diagnosis of diabetes mellitus can be made by your physician. Types of diabetes, as we know, there are several types. The most commonly is type 2, but as you can see here, we have type 1, where the body does not produce adequate insulin. Type 2 is when the body does not use insulin properly. And then the third one, most people don't realize until they encounter, such as during pregnancy, is gestational diabetes that occur. Etiology, as you can see here, the type 1 is usually occur because of not producing adequate insulin. So a lot of type 1 being result from genetic disorder, mutation disorder. Type 2 is when our body cannot effectively use insulin being produced. Again, majority of this condition occur because genetics, but we may not being classified as diabetes yet until much later in life, being influenced by lifestyle and environmental issues. As you can see on this cartoon, type 1 diabetes is from insufficient insulin production. And then for type 2 occur because our body resistant to the action of insulin. Again, type 2, where our body does not have adequate sensitivity to accept insulin. The symptoms of diabetes are increased thirst, increased hunger, frequent urination, fatigue, blurred vision, slow healing sores or infections. And if you can think about these symptoms, the reason why they occur is because of too much sugar. So when we have too much sugar, the sugar would be produced into our urine and pull the water with it, result in us being dehydrated and increasing thirst. And then the sugar being lost also create more, is almost like a cyclic cycle that result in increased hunger. And again, when the sugar being produced high amount in urine, we feel like we have to go urination more. And then with the high sugar, we have fatigue sensation. We feel really have good libido. We don't have good mentation. And the high sugar also result in blurred vision, along with increased risk of infection. You have sore, you have follicle being infected, and all of a sudden you wonder why were those happening. As you can see on this, again, it reiterates some of the symptoms of diabetes. Complication of diabetes, the majority of diabetic complications result in vascular and cardiovascular disease. Second, neuropathy. Third, nephropathy. Fourth, a retinopathy. But the fifth one, most of people don't realize is that they now are immunocompromised states.
So next part of the presentation, Dr. Van went over the medical treatment for diabetes.
Treatments of diabetes include dietary restriction, exercises, but the key is blood sugar monitoring. And then we can discuss further regarding the medical therapy, which are the injectable, as you know, traditional insulin, but as you know, recently we also have the GLP agonists, the amylin analogs, and of course the oral therapy, including hypoglycemics, sulfonylureas, DPP-4 inhibitors. And what are the newer therapy there that traditionally we have not heard about, but we have seen on advertised on TV, such as the GLP-1 agonist. GLP-1 is a hormone that helps our body to produce more insulin and to reduce the amount of glucose released by the liver. And then for the oral high glycemic type of medications, the newer one that we've seen on TV advertising as well, result in lower blood sugar by blocking the enzyme DDP4, which breaks down the GLP hormone that we discussed earlier.
Moving on to the more interesting aspect of the presentation, Dr. Van went over the latest trend and innovation in the diabetes space. He presented different topics, including the artificial pancreas with advancement in continuous glucose monitoring devices. And that's one of the biggest development in the diabetes space.
The key thing about treating diabetes effectively is glucose monitoring. As you know, nowadays we also have several types of agenda in living longer. Those people believe that if they can monitor their sugar closely, continuously, and keep it below 100, they will do better and live longer. So we have now continuous glucose monitoring advancement with devices, whether it's wearable or whether implantable, allow us to monitor real-time blood sugar without the need for finger pricking intermittently. Insulin delivering system is also now available, enhancing artificial pancreas system, providing automated insulin dosing based on the continuous glucose monitoring data. And of course, now we also have oral insulin being produced, and that is great advancement, but I believe the future should be the continuous insulin production that based on the continuous blood sugar monitoring within our body. As you can see here, the injectable versus oral insulin. Now we also have smart insulin pens, allow us to, of course, monitor that and work with our smartphone and give our patient guidance. As you see, when TV advertising bombard us with Ozempic, Wegovy, Mounjaro type of medications regarding the injectable now being used not only for diabetes mellitus but also for weight loss.
Next part of the event feature is the latest immunotherapy for diabetes, and that's one of the novel treatment modality that's being developed in the recent years.
As you see, the new medical trend, predictive analysis by integrating machine learning algorithm into our patient data to predict the hypoglycemic versus the hyperglycemic event and allow us to have personalized care. Lifestyle intervention apps is also now available on our phone, allow us to personalize the diet, exercise recommendation to manage diabetes. As you see earlier, the apps also available for our patient to give them guidance regarding insulin management, insulin therapy, and of course the event of telemedicine allow us in healthcare to reach out to a lot of our patients who are not able to get access to healthcare. Believe it or not, a lot of people do not have the transportation to go see their physician. So telehealth medicine would allow that to be accomplished. And great deal of research is undergoing right now on type 1 diabetes using immunotherapy.
Next, Dr. Van also discussed about gene editing using CRISPR-Cas9 system to edit the gene to fix the underlying mutation associated with diabetes itself.
Gene editing, CRISPR therapies also being considered, being managed and used to correct genetic mutation that result in diabetes type 1 and diabetes type 2.
And then next part of the presentation, Dr. Van also discussed about the latest development in big data analytics, machine learning as the novel development to help monitor the complication associated with diabetes.
And of course, the complications that we mentioned earlier also need to be screened more effectively, allow us to have early detection of vascular disease, of retinopathy, of neuropathy, and of course, the management of them will be more effective if we can detect them earlier.
If you enjoy our video, make sure you hit the like button, subscribe to our YouTube channel, share it with your friends and your family. Also, just tap, you don't have to smash on the bell notification button so that you can get our video as soon as they are released. Now, the other thing I want to share with you about is that our fund, we have weekly open mic webinar where our leadership team meet, and our chairman of the medical and scientific committee, that is Dr. Van Nguyen, he's a cardiologist, also medical director. And he and our team present on the latest advancement in the life science sector. We cover many niche, many topics, which allow me to gain an advantage in the life science sector. And in knowing so, I can fine-tune my research position and invest in young, innovative companies before they blow up big. Let us capture the tremendous upside in the biotech stock market that will occur in the next few years for you. If you're interested in learning more about our fund, You can check out our website, www.evergrowthinvest.com. You can also reach us by email, info@evergrowthinvest.com, or by phone 704-957-7746. Reach out to us to see if we are the right fund for you and if you are the right investor for us.